Hello, everyone, and welcome to the Community Foundation for Northern Virginia's deep dive session around the health and safety of Northern Virginia's youth. My name is Sari Raskin, and if you could let us know who you are in the chat, and also just as a reminder, today's session will be recorded and available on our YouTube channel afterwards, and we will be hosting a Q&A session after Dr. Denise Bellows' presentation. So please list your questions in the chat, and we will answer them at the end of the session. We like to start on time. So again, I'm Sari Raskin. I'm the Vice President of Grants and Community Leadership here at the Community Foundation. Welcome and thank you for joining us today for our second deep dive session. For those of you who were able to join us on our first deep dive in December, it was focused around the general demographics of youth in our region, and that is available on our website at cfnova.org. So feel free to look at that if you want to have some background information as well. But I'm thrilled to be back here today with Dr. Denise Bellows, who's our Senior Director of Insight Region. And for those of you who don't know, Insight Region was launched in 2020 with the goal of analyzing local trends, informing our donors and the community, all of you and others, about what the issues are that we should be thinking about and supporting and trying to solve problems around. And then also guides us in our own internal grant making, or the grant making that we do in the community. So it's proven to be a great resource. There have been multiple reports, all of course on our website, and this deep dive is an example of some of the research that we are and data that we're uncovering, and all of this information around children and youth will be highlighted in a larger report that will be launched on March 25th at our Shape of the Region conference that's going to be focused on the health and safety of children in Northern Virginia. So I encourage you all to register if you haven't already. And I'd like to quickly just take a moment, and then we'll let Denise just start telling us about what she's uncovering. Introduce Dr. Denise Bellows, who joined us in 2023. And Denise has been amazing to help us, again, uncover issues that are really important to us and we should be looking at to inform our work. And I'm looking forward to learning from Denise, and just to give you a sense of where Insight Region fits within the larger Community Foundation work. Under community leadership, we have our Insight Region data and research, and then it informs our grant making. So grant making is also part of that, as well as our events. And we've done recently have really worked very thoughtfully and strategically, actually, to align all of our work. So I'm thrilled to introduce Denise once again, our Senior Director of Insight Region, who will tell us and give us an update around some of the key issues around the health and safety of our region. Denise.
Thank you so much, Sari. I appreciate the welcome. Welcome to everyone on the line. I'm excited to be continuing our deep dive series. Again, my name is Denise Bellows, and I'm happy to share what I've been learning over the past year about the health and safety of Northern Virginia's youth. So just to set ourselves up for today, while Insight Region has addressed various aspects of youth in recent reports, a comprehensive examination of Northern Virginia's youth has not been conducted by the Community Foundation since our 2010 report, A Portrait of Children in Northern Virginia. My colleague Amanda is on the line. She's going to put the link to some of our prior reports in the chat for you if she hasn't already, just so if you want to reference them later to see some of our prior work that Sari had mentioned earlier. And once again, just to share, a recording of this presentation will be available on our website following this event, so don't feel you have to take notes or anything. So 2010, let's see, that was a long time ago, right? 15 years ago, maybe hard to imagine what life was like. So that was our last report. But to center us, this is when we're talking about today's youth. We're going to be pulling data mainly from 2022, sometimes data from 2023 or 2024. So the population of youth under age 25 in 2022 were born between 1998 and 2021, making them about half Generation Z, half Generation Alpha. So let's just call them Generation Zalpha for now. So without further ado, when we're talking about youth, we mean this group, Generation Alpha, our current youth. So what do we know about Generations Alpha? In our last deep dive, we talked a little bit in depth about the demographics of these youth. We learned that our youth population has grown 25%, but this growth is actually slower than we've seen in prior decades. Most of our youth in Northern Virginia are a little bit older, age 10 to 24, and the population of youth under age 25 has decreased in Northern Virginia over the past decade. And this decrease is slightly more than what we see when we compare to birth rates and declines in birth rates in our region. Our youth population is increasingly diverse, with more and more youth identifying as multiracial and multi-ethnic than a decade ago. And over the past decade, the proportion of children in immigrant families has also increased. It remains double that of the Commonwealth. So for example, in 2023, nearly 50% of Northern Virginia's youth lived in immigrant families either as a foreign-born youth or a child of immigrant parents. So let's start talking about health and safety. So we'll start by examining how safe our youth feel. Over the past decade, the percent of high schoolers in Virginia who did not go to school because they felt unsafe at school or on their way to or from school more than doubled from 2013 to 2023. And that's that gold line you see on the bottom of the graph there. Now, in Northern Virginia, specifically, 10% of high school students reported that they did not go to school because they felt unsafe in the 2023 Virginia Youth Survey. So this was more common among 10th graders and also among our Hispanic and Latino students. So for Northern Virginia's middle school students, 14% said they did not feel safe and secure in their neighborhood most of the time or all the time. And this was also more common among Hispanic and Latino students. When asked about feelings of safety at their schools, 27% of Northern Virginia's middle school students did not feel safe most of the time or all the time. So nearly 1/3 of middle school students. Not feeling safe and secure at school was more common among females, middle school females, and also middle school Hispanic and Latino students. So another survey that asks about feelings of safety among our youth is the Virginia School Survey of Climate and Working Conditions. And over the past decade, we know that more and more schools have opted to hire school security officers, or SSOs, and school resource officers, or SROs. So how are they different? Well, we know, so approximately 55% of schools in Virginia have a school security officer. Those are individuals employed by the local school. They're responsible for maintaining order and discipline and preventing crime, investigating violations of law or policy, and detaining students who violate law or policy. They're mainly responsible for enforcing laws and ensuring safety of students, faculty, staff, and visitors. So that's 55% have a school security officer. A school resource officer, on the other hand, those are employed by 68% of schools in Virginia. They are employed by local police. So they are certified law enforcement officers. They provide law enforcement and security services to public schools. However, they also have responsibilities to be law-related educators, and they are intended to serve as role models or informal mentors to youth in the school setting. So most students who responded to that survey about school resource officers said that they strongly agree that they feel safer because of the presence of an SRO or an SSO at their schools. And of the 68% of students who have an SRO in their school, 75% had a favorable view of their SRO. And of those who do not have an SRO at the school, we learned that 25% of students and 50% of teachers said that they would feel safer if their school had a school resource officer. So related to feelings of safety is bullying. Over the past decade, many studies have confirmed relationships between bullying and negative short and long-term outcomes such as anxiety disorder, depression, post-traumatic stress disorder, personality disorder, sleep and eating disorders, anger issues, and substance use. And we'll talk about substance use on some later slides. The Virginia Youth Survey asks middle and high school youth about bullying, and they've asked these same questions for over a decade. They define bullying in the survey as when one or more students tease, threaten, spread rumors about, hit, shove, or hurt another student repeatedly. So they explicitly state bullying is not when two students of about the same strength or power argue, fight, or tease each other in a friendly way. That's not what we mean when we're talking about bullying. Now, electronic bullying is being bullied through texting, Instagram, Facebook, or other social media. So as we're reviewing these data on bullying in the next few slides, know that this is how we're defining bullying versus electronic bullying. So on this slide, you'll see the trend for middle school bullying. High school bullying, just want to add, is not in the same graph because the questions are asked slightly differently on the middle school and high school surveys. The high school survey asks about bullying in the past 12 months, while the middle school survey asks about bullying in a lifetime. So the middle school numbers might seem a little bit higher compared to the high school numbers. So that's why we don't have them in the same graph here. But the good news is that the high school bullying has been trending downward over the past decade. Now back to the graph, the dotted line in the chart provides the national data as a basis for comparison. And you can see that middle school bullying in Virginia is pretty consistent with what we see in the national trends as well. In the Commonwealth of Virginia, the percent of middle school students who were ever bullied on school property decreased 18% from 2013 to 2023. However, the percent of middle school students who were electronically bullied increased 30% over the same decade. And both of these changes are statistically significant. Now, these figures examine the two types of bullying for Northern Virginia versus the state of Virginia by grade level. So the figure on the left represents high school data, and the figure on the right is the middle school data. The blue bars represent in-school bullying, and the goldish bars represent electronic bullying. The darker shades are the colors for Northern Virginia, and the lighter shades are for the Commonwealth of Virginia. So consistent with our 2010 report findings, in both figures, we can see that the amount of bullying in Virginia, the lighter shades, is much greater than here in Northern Virginia. However, there are two small exceptions. Northern Virginians in 6th grade and in 12th grade reported more electronic bullying than in the rest of the state. This graph also shows us where electronic bullying surpasses in-school bullying in Northern Virginia. We can see that 8th grade seems to be the first grade where electronic bullying is reported more than bullying in school. And the next big difference in electronic bullying comes in around 11th grade. So it's represented by these arrows in the graph. Now, nationally, 16% of high school students were bullied electronically in the 12 months prior to the survey, and 19% were bullied at school. So Virginia is slightly below the national average for electronic bullying and consistent with the national average for school bullying. And thus, Northern Virginians are reporting bullying less frequently than states in the rest of the nation. So I want to take a minute to share some additional findings about online bullying in Northern Virginia. The Fairfax County Youth Survey found that almost 20% of Northern Virginians in 8th through 12th grades believe, quote, "I have the right to say anything I want online, even if what I say hurts someone or violates someone's privacy." So with this finding, it could be helpful for parents and schools to discuss online etiquette with our youth or monitor their social media interactions more closely. New policies, such as the governor's executive order banning cell phone use in schools, may impact electronic bullying, at least during the school day, in the coming years. So stay tuned up for our discussion about this with Michelle Reed, Superintendent of Fairfax County Public Schools, at our Shape of the Region conference on March 25th. So now we'll talk a little bit about mental health. So feelings of safety and bullying can impact the mental health of our youth. In a prior Insight Region report on youth mental health, we found that more than 50% of Northern Virginia's high school students experienced a recent mental health need, and 37% reported anxiety or depression at the clinical level. A recent past year mental health need was also reported among 50% of middle school students. The Fairfax County Youth Survey data show us that mental health need was reported more frequently among girls, transgender or questioning youth, lesbian, gay, bisexual, or queer youth, and students experiencing recent food insecurity. Now, to introduce our next topic, I'm sharing this figure from the New York Times recent findings from the CDC Wonder database, that in the United States, Firearms have become the leading cause of death for children in the past decade. It surpassed traffic accidents. So given this and other regional efforts around violence prevention, we began to explore firearm injury and death in Northern Virginia. So in Northern Virginia, the rate of firearm injury per 10,000 emergency department visits has not returned to pre-pandemic levels. So you can see in the graph that the rate of firearm injury was higher in 2023 than it was in 2018 and 2019. The rate has come down from 3 per 10,000 emergency department visits in 2020 to 2.2 in 2023. So to put this into perspective, the average rate of firearm injury per 10,000 emergency department visits in Virginia was actually 6.2 per 10,000 over the course of a span of 5 years. Richmond actually leads the state in the number of firearm injuries with a rate of 16.5 for 10,000 emergency department visits. So our region does not have the need we see in other parts of the state, and rates of firearm injury in Northern Virginia are less than half the rate of the Commonwealth. Still, like the rest of Virginia, gun-related injuries were on the rise in Northern Virginia's emergency rooms and remain elevated. So after seeing the firearm injury data, I also examined firearm deaths in Northern Virginia. I found that 170 youth died from firearms from 2022 to 2023. The figure on the left shows the total number of deaths by jurisdiction, and the figure on the right adjusts for population size by showing the rate of firearm deaths. So when controlling for population size, you can see that youth firearm deaths are elevated in Alexandria, Fairfax, and Prince William counties. These figures also show the age distribution of firearm deaths by jurisdiction. So both total firearm deaths and rate of firearm deaths are highest in the 20 to 24 age group. However, there are still significant firearm-related deaths in our high school-aged youth, represented by the dark blue and light blue bars in the graph. Now, these data only show us firearm-related deaths by age, but they don't tell us about intent. I was again surprised when I examined firearm injury by intent. So according to the Virginia Department of Health's firearm death data, the majority of firearm deaths in all jurisdictions in Northern Virginia are suicides, not homicides. So despite the impression that I had received, probably from the news, and this is consistent with state and national trends, actually. Though homicide prevention and awareness is still critically important, given the data we have about Northern Virginia, it leads me to believe that firearm-related suicide deaths should be given further attention and resources in our region to support prevention, intervention, and trauma-informed support for those impacted by these tragedies. Firearms were used in more than 50% of suicides in 2022. However, regardless of the method, firearm or by other means, the rate of suicide among youth aged 5 to 24 was 8 per 100,000 in Northern Virginia. So the good news is that this rate is nearly half the national rate. The bad news is youth suicides in Northern Virginia have increased since our 2010 report, when the rate was 5.5 per 100,000. Suicide remains a leading cause of death in the United States and a leading cause of death among youth. We also know from the data that girls make more suicide attempts and have more hospitalizations, but male attempts end in death more than female attempts, making the number of suicide deaths much higher among males than in females. It's important to make our community aware of the National Suicide and Crisis Lifeline. Youth can call, text, or chat online. Recent studies and suicide prevention interventions have shown that our younger population has greater success in communicating via text with these suicide prevention hotlines. And adults can also have an impact by responding positively to youth in our community. So in our report, we'll go a little more in depth, but here I'll just share a few interesting findings related to substance use. So one of the most severe potential outcomes from substance use is overdose. In 2023, there were 63 drug overdose deaths among the 0 to 24-year-olds in Northern Virginia. That's a 43% increase from 2022. In the past year, the Prince William County Health Department conducted a detailed analysis of opioid needs and found that the problem is skewing younger. They believe one reason may be that 20 to 25-year-olds have a harder time engaging in opioid treatment. In 2022, 7 Virginians died of a drug overdose every day, and 79% of overdose deaths involve fentanyl. So approximately 15% of the 1,712 total opioid overdose deaths in Northern Virginia in a 5-year period were among youth age 0 to 24. So 15% of all overdose deaths among youth are among youth. Now, nationally, when you look at that number, it's actually closer to 7%. So again, nationally, when you look at the share of overdose deaths that are youth under age 25, it's 7%, and in Northern Virginia, it's 15%. So a larger share of these 255 opioid deaths occurred in Fairfax and Loudoun counties from 2018 to 2023. On a more positive note, opioid deaths did decrease from 2022 to 2023, but substance use has not decreased. The decrease in these deaths is likely due to the increased availability of Narcan to rescue those who overdose. One other trend I observed is that while deaths decreased for most substances, in the past year, cocaine-related deaths have been increasing significantly over the past decade in this region. Now, the Virginia Department of Health has been studying the state's overdose needs through this index of 12 indicators, including emergency department visits, fatal overdoses, infectious disease outcomes, arrests, socioeconomic indicators like poverty and unemployment. And according to that index, the larger jurisdictions within Northern Virginia were ranked as having high needs for improvement in drug overdoses and related outcomes. Loudoun, Fairfax, Prince William, and Arlington were considered high need for drug overdose and related outcomes. Manassas Park, Manassas City, Alexandria, and Fairfax City were considered low need. So briefly, I'll mention what I found about alcohol and cannabis. So the 2022 Virginia statewide needs assessment on adolescent substance use found that while substance use among Virginia's adolescents largely mirrors national trends, all indicators of problematic alcohol use are higher than national trends. Furthermore, the proportion of youth, both in the US and Virginia, meeting the criteria for alcohol use disorder has nearly doubled from 2018 to 2020. On a positive note, we do see a slight decline in alcohol-related youth hospitalizations from 2018 to 2023, and that's the lowest it's been in the last 5 years. So you can see on the graph, we have a slight decline in alcohol-related hospitalizations. Now, among youth aged 0 to 19, cannabis-related hospitalizations are nearly 3 times as high as alcohol-related hospitalizations. Now, the CDC has provided some new information about this Delta-8 THC hospitalizations, which may be contributing to this high rate of cannabis-related hospitalizations. And lastly, let's just look at tobacco and tobacco-related products. The Virginia Youth Survey asked students if they currently smoke cigarettes or use electronic vapor products at least one day during the past 30 days. As we can see, there have been significant declines over the past decade. Still, continued messaging about the dangers of tobacco and nicotine is important. Approximately 25% of Virginia's youth believe that these products are not harmful. Now, Zyn, may or may not have heard of, is a new non-tobacco nicotine product. It's sold in flavors including citrus, cinnamon, coffee, and a variety of mint flavors. Now, flavored vape products ended up in the hands of youth over the past decade, and led to some increases in use. So it will be important to stay vigilant and inform youth about the risks of Zyn. So quickly, let's summarize what we've learned so far from this presentation. For safety, over the past decade, the percent of high school students who did not go to school because they felt unsafe more than doubled. Nearly 30% of middle schoolers felt unsafe at school. Hispanic and Latino students report feeling unsafe more than any other group. On bullying, bullying in person has decreased significantly, but electronic bullying has increased among middle school students. On mental health, 37% of high school students had a recent clinical need. Greater needs exist among students reporting food insecurity, female students, and students who identify with the LGBTQ+ community. On leading causes of death, firearms have become the leading cause of death for children. In Northern Virginia, firearm injury has not returned to pre-pandemic lows. And the majority of firearm deaths in Northern Virginia are suicides, not homicides. Northern Virginia was recently ranked as high need for drug overdose-related outcomes and substance use. 15% of overdose deaths are of youth under age 25. This is double the national trend, where only 7% of overdose deaths are among youth. On alcohol and cannabis-related hospitalizations are nearly 3 times as high as alcohol-related hospitalizations. And though tobacco use is down in Northern Virginia, 25% of Virginia's youth still believe that tobacco-related products are not harmful. So it'll be important to continue education about new nicotine products like Zyn. And I think I managed to get through all that in 20 minutes, so it leaves us a little bit of time for some Q&A. So I'll turn it over to Sari to lead us through that.
Excellent, excellent job, Denise. Excellent.
Mhm.
Yes, we will be, please put your questions in the chat. I know there was a lot of information that you're probably processing, and if you have questions afterwards, you can feel free to reach out to us as well. But we'll take a couple of questions now if you have them. I can start us out just to ask Denise a couple of things, and then we can get the ball rolling. But Denise, I'm just as you mentioned, in 2010 was our last child and youth study. And I'd love to just hear from you any overarching kind of thoughts about how different the issues were and some reflections on that.
Yeah, thank you, Sari. It was it's fun as we decided to pursue this report. We looked at that report and kind of said, wow, there's a lot of things that are different and things that were not in that report that are maybe weren't relevant in 2010, but are very relevant now. So starting with the bullying, right, was the first thing I covered. I don't even think there was much about bullying in that report at all. But now, fortunately, I think we've become more aware of the impact of bullying. And so our state and local surveys, we've been doing more data collection on that. And so we're able to report about what's been happening. And that's allowed us to see the difference and the impact of, cell phone use among youth and screen time and electronics and how that's affecting bullying and then youth mental health. So that was one of the big ones. Another thing that was not in the report as much was opioids and prescription drug use. I think they mainly focused on alcohol and tobacco. So definitely changes with marijuana, cannabis, and opioids over the past 15 years.
Yep,
Yeah.
thank you.
Mhm.
So one question that was asked, so two questions actually. One, thanks, Denise. Do you have disaggregation of findings by subgroups beyond the male-female distinction shared, such as race, ethnicity, disability, etc.?
I mean, yeah, for some of the data we do, and for some it depends on which survey. Most of it's probably accessible if you for some of the data I have, so for example, the firearm data that I have, because they're small numbers, right? To get like the detailed raw data by year, sometimes you can't get that exactly. So they report it over several years, so over a 5-year trend, you know, because that data can be sensitive. But yeah, if there's a specific data you're interested, let me know. I'm sure I could probably pull some disaggregated data.
Great.
Depends on what
Great.
the topic is. Yeah.
So two questions that are relevant to each other is, are you anticipating any grant programs coming out from this presentation, and what type of interventions do you think are needed the most based on this new data? I have to say, this is the value of having alignment, honestly, between our grant making and our events and our presentation at Shape of the Region. Shape of the Region is really going to be about looking at these issues that have been raised within these deep dives and in the report and the general findings, and then talking about solutions at Shape of the Region. So Shape of the Region is going to be, again, creating additional context, what's happening around these issues in our region by experts, by the key voices. And you can look at our, we'll be sharing our registration page, which lists all the panelists, and we're doing a fireside chat at first to set the context for all these issues and what's happening in our region. And then the panel will then be at the end around solutions around these issues. So really connection between the data that Denise is presenting and uncovering the research, right? And then presenting some solutions, hopefully, of what's happening in our region. So we walk away with some positive energy, a feeling like, okay, these are our issues. We definitely have to consider them, but let's think about some things that are happening to try and solve some of the problems.
Mhm. Well said. And I would add here too on the solutions, our next deep dive, right, on April 7th, after Shape of the Region, we'll try to kind of recap the discussion from Shape of the Region and talk a little bit more about how we move forward, given what we know now.
Excellent. Excellent. Another
Oh,
good
oh.
question. Also, great presentation. Are you surprised by the data of differences the differences between national numbers and Northern Virginia numbers? Did your research show what protective factors that are working?
Yeah, I did, like I said, I did uncover some protective factors and, you know, given my background in adolescent risk behavior. There definitely are protective behavioral strategies for youth. Fairfax County has their 3 to Succeed campaign, which is about just the different factors that can help youth thrive, right? And a lot of it, I feel, is related to having a supportive community and social support, which is why I think us coming together to discuss this at Shape of the Region will be really helpful. Um, yeah, and there are, the state has done a lot with doing anti-bullying and bullying prevention programs in school settings. Um, Loudoun County, I mean, I don't want to speak specific to Loudoun County, but there have been a lot of efforts towards opioid prevention and outreach. You saw the state, just the fact that the state has this new mapping and this opioid need tool that they've developed to try to see where the problems are and where the gaps are and where they could dedicate resource to, like that's a big step. And I think that's going to be really helpful in curbing the opioid epidemic and what we're seeing. So,
Great. Well, we've run out of time, but I know that if you have additional questions, please feel free to reach out to us. And just a reminder, the session is recorded and will be posted on our YouTube channel. You can also look at the first session that Denise facilitated as well from December on our website and on the YouTube channel as well. And our next deep dive, as Denise mentioned, will be after Shape of the Region on April 7th. So if you haven't already registered, please do. There's a registration link in the chat. And you can also register for our other deep dives that we're taking this topic and the theme of child and youth through the end of 2025. So please feel free to sign up for the additional deep dive sessions as well. And then finally, mark your calendars, please, for Shape of the Region 2025. As you can see, there's a registration information here and a listing of all of our partners. We are thrilled that we have all these regional partners involved. It'll be a great event, and all these panelists and fireside chat participants, really a diverse group geographically and also from different institutions and angles, and also the issues that Denise raised. We're really trying to make sure that we cover all those issues within the program. And one additional thing we're going to be adding this year, which should be noted, is that we're going to be including youth voices. So actually checking in with and hearing from kids and hearing how they're feeling about living in and growing in Northern Virginia, and maybe some solutions that they may have for our future and for their futures. So stay tuned. Please register for Shape of the Region. And we're thrilled that you are here. And we look forward to continuing to have the information, have you participate in our deep dive sessions, and have the information from Insight Region inform both our community and the work that we do here at the Community Foundation. Thank you so much and have a great afternoon. Take care.